Good afternoon, everybody. My name is Dr. Dennis Goodman. I'm a clinical professor of medicine in the Department of Cardiology at NYU Langone and the Director of Integrative Medicine in the Leon H. Charney Division and Center for Prevention of Cardiovascular Disease. It's my great pleasure to welcome you to another one of our webinar lecture series on prevention and cardiac prevention. It is so important that you join us for these webinars, and we really appreciate it. My thanks go out to Anya, who does an amazing job helping me coordinate and make sure that you have such great speakers. One of them you're going to hear very shortly. How do you ask a question? Throughout Dr. Stern's presentation today, you'll have an opportunity to go to the Q&A and you can ask the questions. I'll be fielding them, and hopefully we'll have some time at the end to answer your questions. Next slide. So some of the upcoming webinars, I know many of you are frequent flyers with us and you attend all of these conferences and webinars that we do. So just to put on your calendars for save the date, on Monday, January 24th next year, we're going to do congestive heart failure prevention and latest treatments. We're going to do a women's health update, Thursday, February 17th, 2022. And we're also going to do something completely different in March next year, where we're going to have a casual conversation about cardiovascular health. We invite you to send in all your questions about any topic whatsoever related to cardiovascular health. And I'm going to have an expert panel taking these questions and having an informal discussion. Next slide. So these are many of the topics that we've had over the past 6 years. We're close to 50 lectures right now, and you can see we cover all sorts of topics related to cardiovascular prevention, and you can see sleep, blood pressure, diabetes, cholesterol, aspirin, stress, oral hygiene. And I've said many times to you that I focus as an integrative cardiologist on what I call the 4 legs of the stool, and that is nutrition, and exercise and flexibility is number 2, good sleep is number 3, and stress management is number 4. And today we're going to have a speaker specifically related to that topic number 4. Next slide. So how do you get hold of us? I'm proud to tell you that we now have our lecture series on YouTube. You can actually get onto YouTube and you can listen to anyone. Most of those lectures that we've done, obviously the ones that are recorded will be on YouTube, and you can listen to any one of those lectures. And especially if you miss one or you tell your friends about one that you enjoyed, that's where you can find us. So how do you get there? Next slide. This is a way that you can be in touch with us. I'm not going to read all these ways, but I did pick out, next slide. One of the easiest ways to get in touch is this website, nyulangone.org/heartlectures. So that is a one way that you can get hold of us and sign up for the conferences. So just so I've got that again, nyulangone.org/heartlectures. Heart health lectures. Next slide. So it brings me to welcome and introduce our speaker today. We really are very privileged to have Jessica Stern, Dr. Stern, to speak to us today. I've heard her and she's a fantastic speaker with tremendous expertise in her field. Dr. Stern is a licensed clinical psychologist. She's a consultant, she's a trainer, she's a public speaker and media contributor. She's a faculty member at NYU Langone Health and is a clinical assistant professor in the Department of Psychology. She obtained her PhD in clinical psychology at Drexel University in Philadelphia. She specialized in health psychology, stress and coping, and military psychology. She completed her pre-doctoral internship at the VA Medical Center in Philadelphia and her postdoctoral fellowship at NYU Langone Health. She's an expert in trauma and post-traumatic stress disorder, anxiety disorders, depression, substance abuse, stress, and attention deficit syndrome. She's a nationally certified provider in cognitive processing therapy and consultant in prolonged exposure, both of which are the 2 gold standard psychotherapies for post-traumatic stress. And I hope she'll tell us a little bit about that today. She's published several academic articles. She's won several awards, including Star of the Year Award in 2021 by the Cohen Veterans Network. She has two primary professional values that she values, and we all do, and that is to support individuals in developing skills to live their best life and to disseminate information to the public about mental health and wellness in ways that are engaging and approachable. I chose Dr. Stern and this topic because this is a time of the year that can be very stressful for many people. The holidays are coming, and there are two major issues that can make people very anxious, depressed, and very sad. And one is that you may end up not being able to be with your loved ones, or you may be very lonely. And the other is maybe you're going to have to meet somebody that you haven't got on with or you haven't seen for years, and it's going to be difficult and awkward. The bottom line is we want you to enjoy the holidays. You have to deal sometimes with these feelings. And I invited Dr. Stern to speak to us today about how do you handle the holidays so that you can, as you said, live your best life and enjoy them. Dr. Stern, welcome, and thank you so much for agreeing to speak to us today.
Of course. Thank you so much, Dr. Goodman, for having me. I'm very, very happy to be here and to share all this information with you out there watching and listening. And hopefully these tips and information will be of resource to you. So we're going to be talking about ways to manage anxiety and depression over the holiday season, which is a time of complicated emotions and experiences for different people. Next slide, please. So first off, I'll share a quick agenda of what we're going to talk about today so you know what's coming. Next slide, please. We'll talk about why the holidays are complicated, a little bit about depression, anxiety, stress, grief, and the complicated interpersonal dynamics that sometimes arise around the holiday season. We'll talk about ways to manage the distress, including some tips and tricks, as well as just general principles for wellness and guidelines to help you guide throughout the complicated holiday nature season of this time. We'll also talk a little bit about how to know when to seek professional help, signs to look out for, things that you can be appraised of as you proceed and move forward in the next couple of weeks. And then we'll talk a little bit about the different types of professional help that are available to you, including therapy, as well as medication for psychiatric conditions and things of this nature. And then we'll wrap up with a Q&A. Next slide, please. So first off, we'll start by talking about the various different factors that make the holidays tough. Next slide, please. So the holidays, we know for many people, are a time of joy and excitement and whimsy and lots of positive feelings. However, what we also know is that for people, it can be really, really complicated. For some people, it's a time of dread. For some people, it's a time of mixed emotions, where there might be happiness and anxiety, or happiness and worry, or happiness and grief. For some people, it might be no happiness at all. It might be an experience of loneliness that is pervasive and holding people back from enjoying the times that come up. And so what we'll do is we'll talk a little bit about some different things that could be contributing to these complicated experiences that people have around the holidays. And these are just a few. Of course, there are other things that might be involved in the picture, but hopefully these will give you a little bit of an insight into the types of things that you can look out for and potentially either work on or manage as you move forward the next couple of weeks. So first off, we'll talk a little bit about seasonal affective disorder. This is an area that a lot of people know a little bit about and are typically pretty interested and intrigued by, and it's something that affects quite a few people out there. So we'll talk about that. We'll talk about grief, recent or distant, and how grief can be just a huge factor that comes up for people at the holiday season and can take what might be a joyful time of year to a time that's actually filled with sadness and overwhelm and sometimes even darkness. We'll also talk about anxiety and stress and overwhelm and the various different things that can lead to just feeling daunted by this time of year, as well as talking about the different interpersonal factors and dynamics that might come up during the holiday season that might be difficult to manage and might take a somewhat exciting time to a somewhat less exciting time. Next slide, please. Seasonal affective disorder. This is something you may have heard of. It's something that's talked about a lot in the news and the press and the media. Something you may have heard of is the winter blues, or the different types of sadness or lowness that might come up at this time of year. Seasonal affective disorder, also known as SAD, which is, yes, an ironic term for this diagnosis, is a specific type of basically major depressive disorder. And what we know about major depressive disorder is that this is a full clinical depression. So this has a whole set of symptoms, which we'll talk about in a moment, that meets a full clinical depression. And what happens is SAD, seasonal affective disorder, is a specific type of major depressive disorder. And what happens is that SAD tends to happen fairly consistently at the same time every year. It is theoretically possible to have seasonal affective disorder in the summer, but most people who have seasonal affective disorder have it in the fall and the winter time. And it's something that can come up on repeat for many people season after season or year after year that can be very impactful for them. And what we know is that many people have some sort of a low-grade winter blues. But for some of those people, which is still quite a lot of people, they have a full-blown seasonal affective disorder. And what comes up is that you might see the typical symptoms of a major depressive disorder with a couple of additional features that are included and can really be impactful in people's life. Next slide, please. So what are the symptoms, the things to look out for? And what I would say is if you are experiencing any or some of these symptoms, what I would do is recommend that you potentially consider, if appropriate for you, to get an assessment by a health care professional, someone who can basically take a look a little bit closer and see if these are the things that are actually impacting you or if it might be something else. What we know about mental health conditions is that there isn't a lot of overlap. So some of the symptoms that you might see here are symptoms that are also present in other things like anxiety or post-traumatic stress disorder or bipolar disorder or other things of this nature. But hopefully this will illuminate for you a couple of the primary things that you can look out for in major depressive disorder. So the first thing is feeling depressed, feeling really sad, really low most of the day, nearly every day, and or feeling like you have a loss of interest in things that you once enjoyed. So the things that used to bring you pleasure no longer bring you pleasure, and you find difficulty in being motivated to engage in the things that you used to enjoy. Other symptoms that we typically see in a major depressive disorder are experiencing change in appetite and weight that are not specifically related to health changes or diet or exercise. So there are things that seem quote unquote random or a little bit hard to attribute to anything other that's an intentional change. Next up, you might see difficulties with sleep. So either increased sleep, sleeping too much, or too little sleep, having a significant decrease in sleep can be something that's present in depression. Similarly, feeling sluggish or agitated, or having a low energy as well. Next, thinking about hopelessness and fear, worthlessness, and fear about the future and being uncertain about what might be coming up for you, and feeling really just dark and empty in yourself can be another feature of depression. Similarly, having difficulty concentrating we know can be a feature of many other mental conditions as well, but it can be present in depression as well. And then sometimes, for some people, having thoughts about death or suicide. I should say that the death or suicide thoughts are not prevalent in everybody with depression. And this is true for actually all of these things as well. In order to have a full clinical depression, you need to have a majority of the symptoms, but not all of them specifically. Specifically in seasonal affective disorder with a winter pattern, fall-winter pattern, the particular context that you might see is oversleeping, so having hypersomnia. So this idea of having a difficult time getting out of bed and just finding that you're very, very sluggish and very, very low. Similarly, oftentimes in seasonal affective disorder, we'll see overeating, and this can be seen through experiencing lots of cravings, oftentimes related to carbs, sometimes things related to chocolate or other types of things. And we know that overeating is the feature that happens at the holidays regardless of depression, oftentimes because there's more feasts and parties and engagements and things like that. However, if you're noticing that the overeating is happening outside of these social gatherings, it sometimes can potentially be related to a seasonal affective disorder presentation. Similarly, weight gain as well. And again, weight gain is the type of thing that we see regardless of seasonal affective disorder, because oftentimes people are moving less in the winter, especially if they are located in a place with a lower climate. However, again, if you're finding that it's not specifically related to that, it can be a presentation or a factor in seasonal affective disorder. And then lastly is social withdrawal, or feeling like you're hibernating. This last one's a little bit tricky because during COVID, a lot of people have been withdrawing socially. And so it's not necessarily always just related to seasonal affective disorder or depression. But if you're noticing that it's hard to sort of engage in the increased activity that's happening with the world very slowly opening up, that might be a feature as well. Or even finding that it's really difficult to connect with people virtually can be a sign that something is happening from a depressive perspective. So again, you might not experience all of these symptoms, but if you're noticing a lot of these symptoms, it's really resonating, then it might potentially be an indication that it's worthwhile seeking out an assessment for depression. Next slide, please. In terms of seasonal affective disorder and the holidays, so unsurprisingly, based on the fact that we talk about it, that it largely happens the winter time, there's an overlap. So we know that seasonal affective disorder is happening at the same time, this time of year, when a large chunk of holidays are happening. And for a lot of people, seasonal affective disorder can make enjoying the holidays much more difficult. They feel low, they feel disengaged, they find that it's hard to connect with other people, they find that it's hard to enjoy the things that they maybe found enjoyment in, holiday traditions, things of this nature. And so that can make it really complicated. Similarly, another way in which these two can connect and make things complicated is that for some people, the acute holiday period, so let's say late November, December, up through New Year's, might be almost a temporary distraction from seasonal affective disorder. And what I oftentimes hear people say is that come early January, they get hit really hard with their depression. And so it's almost like they had that distraction opportunity with the holiday season, and then they feel very, very low for the remainder of the winter season. And that can be very overwhelming for a lot of people and can lead people to a large sense of dread. And so if you're noticing that in any way, shape, or form, your mood is potentially impacting your ability to enjoy the holidays, or conversely, that the end of the holiday season brings on a significant increase in depressive symptoms, that potentially might be happening, and that might be the relationship that's happening as well. Similarly, we also know that other types of things might be coming up in terms of mental health for people. And I'll talk a lot more about anxiety and grief specifically in a moment, but other things like post-traumatic stress disorder can be really, really tough. So PTSD, post-traumatic stress disorder, is an area that I work very closely in. And we oftentimes find that for a lot of people, experiencing PTSD at the holiday time can be very difficult. It can make it really hard to engage in, again, those holiday traditions that you used to find enjoyable. It can make it really dreadful to spend time with family and friends, because if you're finding that you're really low, it can be really overwhelming to spend time with people who are feeling elated or, enjoying themselves and that type of thing. So that can be really, really tricky as well. And we oftentimes find that there's a relationship between depression, not specifically seasonal affective disorder in particular, but depression in general, and post-traumatic stress disorder. And so if you or someone you know is experiencing PTSD, this may potentially be a very tough time. And when I talk a little bit more about grief in a few moments, we can talk more about how this potentially relates as well. And so again, if you experience depression, if you have a tendency to experience depression, that might be something you want to consider. Is this holiday season in any way, shape, or form being impacted by the depression that you're experiencing? And the good news is that there are ways to treat both general major depressive disorder and seasonal affective disorder, which I'll talk about at the end of today's talk. And so if you are experiencing those types of things, please don't despair. There is hope for you. Next slide, please. Anxiety. So anxiety, we know, comes in many, many shapes and forms and affects so many people. It is probably one of the most commonly experienced symptom profiles, if you will, that people have, and it can come up in a lot of different ways. So what we know is that for some people, it's minor worries, things that are occasional, things that are manageable, but can pop up every so often. But for other people, it comes up more frequently and more consistently, and can sometimes be more impactful to someone's life. In terms of anxiety disorders, there are many, and here I have listed just a couple. And so this can give you an opportunity to think about the types of things that you might be experiencing. However, please know that there are other types of anxiety disorders as well. Just for the purposes of time, I'm only mentioning a couple. The first one is social anxiety or social phobia. And social anxiety is something, it's a term that people throw away quite often, but it's actually a very specific experience in which people find that when they are interacting with other people, whether that's social engagements, having a good time with friends and family, giving public talks, presentations, public speaking, those types of things, and many, many other types of things, they feel very, very anxious to the point where they can't do the thing that they want to do or the thing that they're trying to do. And it can be very overwhelming. It can be accompanied typically with a large fear of judgment or fear of rejection or those types of things. And the reason that social anxiety can be impactful here during the holiday season is that it might be difficult for people to interact with other people around them. And because we know that the holiday season is associated with lots of social gatherings, this can be an especially challenging time for people with social anxiety, which we'll talk more about in a moment. Generalized anxiety disorder, also known as GAD, is an anxiety disorder in which someone experiences consistent worry that is associated with multiple different domains in their life. What does that mean? That means that someone experiences anxiety in lots of different places in their life, potentially family life, work life, school life, general health related. And so the point here is that the anxiety is not associated with one specific domain in their life, but it's general and it's happening frequently. And typically in GAD, what happens is people experience anxiety or worry that's really hard to manage and sometimes really hard to control. And this can be really overwhelming. And the way I like to think about it and describe it to people is it can be this experience where people find that their mind is like on sort of this hamster wheel. It's constantly turning, constantly thinking of worst case scenarios, which can be wildly exhausting for people. So GAD can be really, really tough, especially at the holiday season, which we'll talk about in a moment, but is something that comes up for people all year long and can be hard to manage. Panic disorder is another one. Panic disorder is affectionately known as fear of fear. And this is basically a scenario in which people experience or have experienced panic attacks and then have consistent worry that they're going to have another panic attack. Many people out there have had a panic attack at one point or another. What makes a panic attack become a full-blown panic disorder is that it's associated with tremendous anxiety about having another panic attack. And that's something that comes up for a lot of people. Next up is phobias or specific fears. So these are fears that are impairing in someone's life that are associated with a specific thing. A common example, one that comes up for people during the holiday season, is a fear of flying, for instance. And so if you have travel plans, you're going to see friends or family or that kind of thing, you're planning on going away for winter break, but you're finding that you're consistently turning down opportunities that you would otherwise enjoy because you have a fear of flying, that potentially might be a phobia. And if you want a clarification on whether or not it's a full-blown phobia, you can again consult with a healthcare provider to assess. There are many other types of anxiety disorders. Obsessive and compulsive disorder is another one, among many others, but these are a couple of the major ones here. And what we know is that when anxiety comes up, it can be really overwhelming and really daunting. And during the holiday season is no exception. So we'll talk about that here at our next slide. So next slide, please. What are the ways in which anxiety can come up during the holidays? Well, quite a few, actually. And here are just a couple of examples, but of course there are an infinite amount. What we know is that, like I mentioned, social anxiety can come up for people, particularly during the holiday season, in ways in which they are having a hard time engaging in social gatherings. So where they feel that sort of anxiety-provoking impairment where they can't do the things they want to do, holiday parties, going out to Rockefeller Center to see the tree, whatever it might be. If they're finding that they're turning down opportunities or that they're feeling really trapped in their anxiety such that they can't enjoy, that can potentially be very overwhelming and can really dampen the joy that comes about during the holiday season. And for a lot of people, that brings a sense of dread. What we know especially true is that COVID added a whole nother dimension of anxiety for people related to interacting with people socially. And we know that a lot of the anxiety that people had during COVID was useful and was appropriate because there was a level of caution that we all needed to exercise and still do need to exercise, by the way. But what happens is for a lot of people, they feel very trapped by knowing what they can and can't do and are therefore really struggling to make plans and to enjoy the holiday season. So that adds a whole new layer that we didn't have a couple of years ago. For other people, what we know is that the various different tasks and considerations that happen during the holiday season can be very overwhelming. There's a lot that can be having to decided upon in terms of who do you spend time with? Do you go to the in-laws? Do you do this with the kids? Whatever it might be. And there's a lot of decisions that need to be made. And that especially for someone with generalized anxiety disorder, can be really, really overwhelming. Similarly, and this is a little bit of a separate discussion point that I don't have time for in this talk, but another area that I do a lot of work on is I work with adults with ADHD, attention deficit hyperactivity disorder. And what we know is that for people with ADHD, feeling inundated with tasks and decisions can be very, very overwhelming and can lead to anxiety in and of itself. And at a time like the holiday season where there are so many stimuli, so many things that are happening at the same time, this can be really, really overwhelming. Similarly, for post-traumatic stress disorder, where sensory overload can be very overwhelming, this too can be a time in which all of those tasks, those delegations, responsibilities, those types of things can be just very overwhelming and lead us to a sense of dread. Like I mentioned before, specific anxieties can be triggered at a time like this. So for instance, fear of travel, worries about COVID, things of this nature, it can be really, really tough. And I know from many different people that I'm working with in my clinical practice, they're talking about how all of these various negotiations that need to happen and all the planning and the PCR tests that need to be done, it feels tough and it feels really hard to find ways to engage in the things that they want to enjoy and to be able to have that sense of happiness at this time. And especially because we lost out on the same level of holiday season last season, what I think a lot of people are experiencing is almost this increased pressure to do things that they weren't able to do last year. For a lot of people, it's exciting that COVID is slowly allowing them to live a little bit more fully this year than last year. However, for a lot of people, it feels like a lot they have to catch up on, and that can be really, really hard. Other types of things that come up for people at the holiday season in particular are other types of mental health conditions or other types of struggles. So two in particular that I have listed here that are ones that I hear a lot about are substance use difficulties and eating disorders. So for instance, individuals who struggle with, let's say, alcohol and are maybe in a period of sobriety, they're trying to not drink, they might go to families' houses or friends' houses and feel very uncomfortable about either having to explain why they're not having alcohol or having to have a lot of people around them drinking and for them to have to suppress their own urges. Or for some people who choose to drink, they might be trying to decide how much is too much or how much is too little or whatever it might be. And so having to make a lot of those, again, sort of internal negotiations can be really, really challenging. Similarly, for eating disorders, the holiday season can be really, really triggering for people with eating disorders, especially with all of the food that's happening and all of the commentary about eating and things of this nature. What happens when you have a lot of people all together is sometimes you have opinions placed upon you that are not appropriate. And so for people both with substance use disorders and eating disorders, there can be this difficulty in trying to navigate social interactions where they're not feeling triggered by the things that are around them and the stimuli that are around them, which can be very, very challenging. And what I would say too, in terms of anxiety in general, is that two areas that I work closely with, I treat a whole host of different types of adults. I work mostly with adults, but two areas that I work a lot with are military and veteran personnel and also frontline healthcare workers here at NYU Langone Health. And both of those populations tend to have very high levels of post-traumatic stress disorder or trauma, particularly with the frontline healthcare workers at a time like now during COVID, which has been tremendously overwhelming. And huge shout out to the folks who are working so hard and all of the, the frontline healthcare workers, not just the healthcare workers, but everyone doing the job that needs to maintain a large system like this. thank you, first of all. But second of all, this can be a really, really hard time, and it can be filled with anxiety and trying to navigate all of the different complexities and basically trying to enjoy at a time that has been so hard can be really, really tough. And so regardless of what you do, what your occupation is or isn't, or what kind of lifestyle you lead, you might find yourself in a situation where you might be experiencing anxiety, stress, or overwhelm, and that can feel particularly heightened at a time like the holiday season. Next slide, please. Okay, a little bit more about stress, overwhelm, and anxiety. So these are just a couple of examples, and some of these I've touched on already. You might look at this list and say, yep, a lot of these apply to me. And these are some of the things that come up most frequently. Some of these are, fairly inconsequential, and some of them are much more consequential. But a couple of examples are having to figure out who to spend time with, especially during COVID and things of this nature. But even COVID aside, sometimes there's these almost like political decisions in a family of like, which side of the family do we spend time with and things of this nature. That can be really challenging. Similarly, like I've mentioned a couple times thus far, finding ways to manage COVID safety during the holiday season can be very, very stressful, especially with travel regulations and having to test PCR tests and things like that. That can be very, very tough. Similarly, gifts to buy and preparing for get-togethers, even if those are fun things to have to plan for, it's a lot of additional pieces that can be added to someone's plate. And similarly, managing financial stressors. For a lot of people, finances are very, very overwhelming. And this is a time that can be very expensive and can be really challenging. And for a lot of people, they find that they want to keep up with the Joneses, and it can be really hard to do that if you're trying to manage financial stressors, especially during COVID, where many, many people have lost their jobs and lost employment. And it can be really hard to figure out how to maintain a happy holiday season at a time that has been really hard for them with that loss. Similarly, longer than usual task lists, to-do lists that are up the wazoo. Similarly, social media comparison and pressure. This could be a whole talk in and of itself, but finding that you're comparing yourself to what you're seeing in social media, that can be very detrimental to happiness and wellness. Similarly, for a lot of people experience perfectionism, and the holiday season can be a perfect host for perfectionism, meaning that oftentimes people want to try and make it as perfect as possible, do everything right, get everything done, and that can lead to tremendous stress and anxiety for people. And then lastly, on this particular list, although there are many, many more, are having difficulties with work-life balance. And I think especially now where people are really trying to find that balance as best as possible, it can be really hard to place boundaries and things like that. You know, some people in their jobs, they have a lot of time off, and so making that balance is easy. For a lot of people, they don't have that luxury, and they're going to be working through the holidays or have to be on call or work in the grocery store or things like this. And so work-life balance can be much more challenging, and finding a way to enjoy the holiday season can be really hard for a lot of people. Similarly, what we know about the holiday season is it can be very lonely and isolating, and this can be true for a lot of different reasons. Firstly, we know that during COVID, a lot of people have to, spend time apart from other people, and this is thankfully getting a little bit better, but it can be really challenging to know who you can spend time with. Similarly, a lot of people don't have the ability to spend time with their loved ones this holiday season, and that can make it feel so much more lonely and so much more isolating, and that can be really challenging. And if you don't have family near you, or if you have a strained relationship with family, or you don't have a significant other, that can be a really tough time as well. And that can take what might be a happy time of the year and make it a very unhappy time of the year. Next slide, please. Grief. Grief is hard, and grief is, I think, probably one of the biggest factors that leads to the holiday season being so challenging for a lot of people. And we have been experiencing a lot of grief as society in the past couple of years in particular, but we are no stranger to grief, especially during the holiday season. For a lot of people, the holidays can be heavy and they can be very, very somber. And the reason for this is because oftentimes the holiday season can lead someone to remember their loved one even more than usual. And this can be true for either a recent loss or a distant loss. And what I say here on this slide is that there really is no statute of limitations on grief, meaning it doesn't matter how many years it's been, grief will always be there and grief can always pop back up. And so the reason I mention that is I have a lot of people say to me, both in my clinical work and also I'm a co-host on the psychiatry show on Dr. Radio, and I had callers call in recently on a recent show where we talked about grief, saying, I don't get it. The loved one in my life died 20 years ago. Why am I still feeling this? And what I said on the air on that show, and what I say in my therapy sessions as well, is that that loved one is with you forever. And so no length of time could be too much for you to feel that sadness and that heaviness. The good news is that over the course of time, you start to grow around that grief. And so proportionately, the grief might be smaller than the rest of it, but the grief is still there. And the reason that's important to note is that it is normal for you to experience grief even many years out and many years later. What can be really hard is to find a way to participate in the holiday season while managing the grief. And this can be hard because the holidays, like I said before, can be sort of a huge precursor to remembering the loved one and having a hard time connecting to the positivity of the holiday season. What could also be really challenging is if you're spending the holidays with family, and let's say all of you have lost the same person, you might find a difference in the way people in the family are grieving. So some people in the family might want to talk about the loved one. Some people might say, I can't do that, it's too sad, I don't want to talk about him or her. And so that can be really hard because you and yourself might not know, like, can I talk about this person that I love? And can I bring them up in conversation and talk about memories and show pictures and things like that? And when you have that different style within the same system that you're spending time with around the holidays, that can make it much more complicated as well. Next slide, please. This leads me to interpersonal dynamics, and we'll come back and talk a little bit more about tips to manage grief in just a moment. But interpersonal dynamics is another very, very complicated thing that can come up around a holiday table. And this can happen for many different reasons. What oftentimes happens is, and I hear this all the time in my therapy sessions, and again, I heard this a lot on a recent episode of Dr. Radio that we did, is sometimes people will go to their families or their friends and they might experience people in the home that are talking about things that are very upsetting to them, or they might experience family tension. And there are many, many different reasons for why tension might arise. And this can be really hard, especially at a time where you want to have joy and merriment and whimsy and all of those types of things around the holiday season. When you're spending time with people where tensions can arise, it can be really, really hard to manage. And like I said, it could happen for many, many different reasons. Sometimes when you have a group of people who have complicated dynamics all in the same space, those dynamics might erupt even when you least expect it. Similarly, I think now at a time where so many topics and values are much more impassioned, whether it's politics, thoughts about COVID, whatever it might be, you might have an increased likelihood to have difficult conversations around the table, and that can be really challenging. And I've had a couple of very meaningful conversations with people in therapy sessions where they've said, specifically around this past Thanksgiving, I was really terrified to go back home because I didn't know what I was going back home to. And I was expecting X, Y, or Z argument to erupt. And for some of those people, those arguments did. And some of those people, it wasn't as bad as they expected. But what can be really, really helpful, and we'll talk more about this in a moment, is finding ways to manage that and to prepare for that in advance. Because that can be just a little bit relieving of a potential edginess that might arise during the holidays. Next slide, please. So what do you do? So imagine that you are feeling like you might be experiencing something that I talked about at the talk today, but you're not really sure. So these are a couple of different signs that you can look out for, but I will say there are many, many more. So if you're thinking that there might be something there, I do encourage you to speak with a professional who might be able to help as well, or even just start off by speaking to someone in your social network as well. A couple things to look out for. One is feeling on edge. Similarly, feeling very irritable, getting irritated by things pretty simply, experiencing a lot of worry, feeling an emptiness or a heaviness that's hanging with you a lot, having difficulty concentrating, focusing on the past comes up a lot, especially with grief and depression and trauma in particular. Isolating from others, especially in situations that are not logistically related. If there's a logistical reason why you're isolating, that's maybe one thing, but finding that you're isolating maybe due to mood or lack of motivation is a different story. Not doing the things that you enjoy, and then feeling uninspired or unmotivated to partake in the holiday festivities is another one. Next slide, please. So tips, I'm going to speed through these real quick, but I do hope that they are meaningful for you. Next slide, please. Tips for general wellness. First of all, set boundaries. It's the greatest tip I have, and I think it can be used in so many different ways. Set boundaries with people, activity, or work. Similarly, say no where you can and where you need to. Don't be afraid to say no. It is one of the most powerful words and can be really, really helpful. Next is plan time for yourself. Make sure that you preserve your own energy and your own wellness at a time like now. That's really especially important. Similarly, communicate your needs with other people, both in advance of a social gathering or in the moment. If you need something, share it with a trusted person that you can. Similarly, stick to the healthy habits that you've maintained all throughout the past couple of weeks, years, whatever it might be. Don't let those go. And any valuable routines, valuable morning routines, walking routines, whatever it might be, try to implement them, especially if you're traveling. Create game plans before holiday gatherings that might be tricky, but keep some flexibility in them so that way you know that if you need the space to move around, you can. Find someone uplifting that you can spend time with or have a call with. And what I'll oftentimes hear people say is, I don't have anyone I can call. If that's the case, if it's really, really hard to find someone, be creative. So maybe visiting an animal shelter, volunteering in your community, finding a faith-based place that you can spend time in, whatever it might be, just find someone to spend time with, even if you don't know them all that well. Set boundaries with news and social media as well. Next slide, please. Set realistic expectations for the holiday season. So don't overplan for too magical of a holiday season because that might feel like too high of a standard to set. Find small ways to bring joy rather than focusing on the larger ways, even if that means making your favorite festive coffee. Set small goals, realistic goals for yourself that can be really meaningful. Practice gratitude where possible. Also finding ways to not judge yourself for difficult emotions that you're experiencing, and then similarly practicing self-compassion. Next slide, please. Tips for managing grief in particular, since we know this is a big one. Let others know what you need from them, and this might change, and that's okay. And so in the moment, give yourself the grace to be able to change what your needs are and to communicate those. Share your feelings with loved ones who are supportive and open listeners. Take breaks during difficult moments. Maybe that means stepping away from the dinner table if you need a moment to recalibrate. Maintain the traditions that fill you up and retire ones that no longer serve you. That is allowed and encouraged. It can be hard to do, but as best as you can, it can be a meaningful practice. Similarly, create and embrace new traditions, small bits at a time, in little ways. Create space for yourself, step away from the table, like I said before, if you need to. If helpful, find ways to incorporate your loved ones into the celebration. So this means specifically the deceased member. If you want to incorporate them, make a dedication, whatever it might be. If that feels like something you're ready for, go ahead and do that. And then give yourself permission to experience a range of emotions in no particular order or predictability. Grief is not linear, and so allow yourself to embrace that and be prepared for that. Next slide, please. And then tips for difficult interpersonal dynamics. Where possible, set expectations and boundaries beforehand. Similarly, where possible, if this is something you can do, find a funny, cheeky, sort of lighthearted way to change the conversation if you need be, and you can practice this on a loved one beforehand. If that's not possible, if it's really, really heated and very escalated, prepare a grounded exit strategy, something that's calm and collected, but allows you to leave if you need to. Plan with a buddy who'll be there just basically to help you diffuse the situation in that tense moment. So talk to them beforehand and say, hey, I need you to be my buddy if I need. And then separate yourself from what others are saying that might bring you down. And so say to yourself, whatever they're saying has nothing to do with me. I'm not going to let it affect me, and I'm not going to take it personally. And then decide what conversations are worth it and which are not. Next slide, please. Next slide, please. when to seek professional help. So really anytime. Now we are at the stage in mental health where, thankfully the society around us is recognizing that you don't need to be crazy or in trouble or something like that to seek mental health care. And I'm so glad that we are way past that stigma. So if you find that you need help, then you're always welcome to. But more specifically, if you're finding that your anxiety, you're overwhelmed, your depression is impacting your life, then I do recommend that you seek out just an assessment, a consultation to see if there may be something that you can do to assist you in your journey forward. And you can see either a primary care provider or a mental health provider and start from there. And if that person is not the right fit for your needs, then hopefully they can refer you to the next person. Next slide, please. In terms of treatments that are available, there are many. Psychotherapy, also known as talk therapy, is largely what I do here. There's a couple of different ways. I do recommend that you give 2 of these a Google if you're interested. The first one is cognitive behavioral therapy, and the second one is acceptance and commitment therapy. These are especially helpful for depression, anxiety, post-traumatic stress disorder, grief, and so much more. They are evidence-based, which means science tells us that they work. We know that they work very, very well, and they are gold standard treatments for this. Similarly, pharmacotherapy or psychiatric medications, psychotropic medications as well. This can be antidepressants, mood stabilizers, sleep medications, things like that. If you're curious of whether or not you'd be a good fit for these medications, again, you can consult with your primary care provider or a psychiatrist. And then specifically for seasonal affective disorder, light therapy might be a good option for you. So similarly, you can talk with a professional to see if light therapy might be a resource for you as well. Next slide. So that's all that I have for today. I hope this was helpful. Of course, as you can see, there's a lot to unpack there, but hopefully these are useful things for you to keep in mind. And Dr. Goodman, I'll pass it back to you.
Thank you. That was wonderful, Jessica. It was really an incredible overview of, I think, every emotion that people feel at this time. And I hope people are taking away some of the tips that you've mentioned. I've got one to throw in as well, and I'm sure you'll agree with me. I once heard the saying that if you want to raise your spirits, raise someone else's. And I think this is a wonderful time to look around you and try to, look at other people's lives and see if you can help them to have less anxiety and depression during this time. So I think inviting people to your Christmas dinner or reaching out to them in any which way during the holidays, no matter what religion you are, I think that helps a lot. Because social isolation is, I think, as you pointed out, one of the major causes. So have you got ways that people can reach out? How do you suggest that in a practical way? Try to go to some community centers, meet people. So when people are socially isolated, they have a hard time going out and reaching out and meeting people. Do you have any tips on that?
Yeah, absolutely. I love that tip, by the way. I think definitely getting connected is crucial. And like you touched on too, practicing empathy on someone else and charity on someone else and kindness can be so meaningful. What I would say is if there's a value that you're interested in or a specific type of community, find a way to get connected in that value or that community. So for instance, if that means something related to your faith, that might be a great opportunity. If you're really into volunteering, that might be a great opportunity. Here in New York City, there's a lot of volunteer opportunities in, let's say, Central Park or some of the other local parks. So sometimes it means getting a little bit creative, but figuring out what you connect to and finding a way to connect to others, connect to the same thing, that can be very valuable. And just putting something into Google and finding something local to you can be, I think, a really great start for sure.
Right. So I've got a question about PTSD, and a lot of us think about it as some veterans or people that have had a war experience, but I think that PTSD affects so many people because of adverse childhood experiences, ACEs, and many other traumas that you deal with, even up to as long away as your childhood and even when you were an infant. So would you just talk about that a little bit? Are these people more likely or less likely to enjoy the holidays? You said that can be a stressful time. On the other hand, it can be a time when you've got your family around you and you can feel, the love of other people. And I think that's such a huge, important thing when we take care of people with PTSD. So could you take a minute and just try to, educate everybody about how would you know if you've got PTSD, and how would you know when you need to be referred, and how do you pick up those patients?
Sure. So PTSD can affect anybody and everybody, regardless of their type of trauma. So I think sometimes the media and the press make it seem like the only people who have it are people in the military, and that's not true. You can absolutely be a civilian with PTSD. It's actually a huge percentage of the group. Any type of trauma, whether it's a sexual assault, other type of violence, natural disaster, traumatic car injury, many other types of things can lead to PTSD, in addition to, of course, combat and other types of military traumas. And basically the idea here is that, well, any of these can be really upsetting. What happens in PTSD is that the trauma lingers such that it impacts people's ability to enjoy their life, their concentration, their mood, their anxiety levels, etc. And so it's basically something that holds people back from living life fully, and it can sometimes be incapacitating for some people. Some people have a higher functioning PTSD where they can do things, but what happens sometimes for people with PTSD during the holiday season is that crowds, bright lights, lots of social interaction can be very stimulating for people with trauma or traumatic experiences, and so it can be very overwhelming. Also, PTSD very commonly travels with depression, and we know that trauma and depression can both impact people's levels of enjoyment. And so those might dampen the excitement that people have during the holiday season. However, Dr. Goodman, like what you're saying, that can be very much true. If someone has supportive, warm family members, this can actually be a really powerful way for people to connect in a way that's meaningful for their PTSD and can actually bring them back to the things that they used to enjoy. So it can be really empowering for some people.
I just want to tell our audience, I know I asked you a question before we started today, what's one of the things you're most proud of in your life? And it was being able to be on Sirius Radio as a co-host. And I think it's because you get so much pleasure of being able to help other people, just living by what I said before, the ability to raise someone else's spirits, help them navigate the system and knowing how to get help. And I've got an excellent question from one of our colleagues in the communications department, Robert Magyar, who is saying, who asks us, with mental health professionals in such high demand at the moment, how do you recommend someone find a therapist when many aren't taking new patients or they don't accept insurance? And I think that's a real problem in the whole world of, psychiatry and psychology, because it's so hard to find the right people and to find people who can help you. Do you have any tips?
Oh, yes. Oh my gosh, it's such a big problem. The great news is that so many more people are open to going to therapy. The bad news is that there are wait lists at the wazoo. What I would say is try your best to catch a wide net. So the good thing with virtual is you could go see someone who's in a different part of your state and it happened via telehealth. Reach out to your insurance networks if that's helpful, your primary care providers. But what I would say is if you're having a really hard time, potentially be open to group therapy. So a lot of practices offer group therapy, which increases the spots available. And there's cognitive behavioral therapy for depression and anxiety that's available in group format. And even if that's not your preferred mode of therapy, what you can sometimes do is get on a wait list for individual therapy, and then in the meantime, do group therapy, which can be helpful as well. But I would say call as many people as possible. I know it's not a great answer, but at the moment, it's the best we've got.
What you kindly said, before the show, before our talk today, that your contact information, your office is, and I'm going to give this number out, and Anya can send it out to people, is 646-754-4775. And it's a way to get hold of you, to see you in consultation, or certainly I think you can help people find the right therapist. So to me, that's one of the real joys of what I do, is giving people tools to find out where they can actually get the help that they need. And here's just one, which is your incredible expertise. And if people call that number, they can make an appointment with you, or they can find out where they can actually get some help. I'm going to end off with one last question, as this is one of our regulars, and I always appreciate it that he comes up with great questions, and that's Stephen Ho. Stephen, you asked about supplementation, and you often ask about the integrative space. You ask, can supplementation be helpful? Vitamin D, sulforaphane, and saffron and curcumin. I'll let you answer in a second. I'll just weigh in here, Jessica, and tell you that I am an integrative holistic cardiologist, and I always try to think about, are there holistic ways that we can help people? And we're talking besides the exercise and, nutrition, and are there supplements that can be helpful? And Stephen's mentioned some of them that have got some data behind them. Sulforaphane comes from broccoli. So if you can get sulforaphane from eating broccoli, you're better off than taking a supplement. But there are studies that show that that does help with anxiety and depression. Saffron is an aromatic spice. Also, some literature that helps to elevate your mood. Curcumin can help you with energy. Vitamin D, we know, also same thing, very, very important for immune function and your energy. And of course, vitamin D for calcification, of reducing your chances of osteoporosis. I'm going to say that I don't typically use these supplements in anxiety and depression. If someone wants to take them, I have no problem with it because there is some evidence. Where I do think we've got better evidence is, and I don't know if you ever check it, I do, and that's MTHFR, which is methyl tetrahydrofolate reductase, and it's an enzyme that is important because folate, it's important that folate gets methylated in the body because it helps with DNA production. So we're making DNA all the time with new cells, and there's very good data that some patients who are depressed, or especially have they resistant depression and anxiety, are folate deficient, or B12 and folate, the B vitamins. So I will check MTHFR, and you can either be heterozygous or homozygous, which means you get 1 or 2 copies of this gene abnormal. And I have often given patients methylated B vitamins or folate in my practice, and I have seen some improvement. And many psychiatrists use a product called Deplin, which is methylated folate at a higher dose. So just be aware of that. I'm just throwing this out. A lot of obviously traditional physicians don't either know about this or don't utilize it very much, but I am very much a fan of getting MTHFR tested in you if you do have problems with refractory anxiety or depression. We're not talking about someone who just has, sad or who it's tough during the holidays. We're talking about people who really have, as you mentioned, a significant depression. Mm-hmm. I don't know if you want to weigh in on that question, but I just wanted to put that out there.
Yeah, I would add one more supplement to that list. I absolutely agree with what you're sharing, Dr. Goodman, which is omega-3 fatty acids. There's a lot of research that shows that it's really helpful for depression for some people. So that might be another one that.
Yeah, thanks for bringing that up. Well, that brings us to the end of our conference. I call it a conference. It feels like a conference. Yeah. It's also feels like a fireside chat. I want to wish our audience and you happy holidays. If you go away with one thing from this today, I hope you'll think about how you can make somebody else, raise somebody else's spirits, because it certainly will raise your spirits. Look forward to seeing you all again in January. Enjoy your family, enjoy your friends, and reach out to somebody who can benefit from your love and care. I also want to end off by saying thank you to Anya, who makes my life so much easier. We put these lecture series on. They're free to the public. We're very proud of them. And I do think it's a great credit to NYU and our prevention center, which is very focused on how do we prevent diseases. We know 80% of strokes and heart attacks are preventable, and it applies to every aspect of medicine. And so anxiety and depression in many ways are preventable through many of the things that you spoke about today. So happy holidays, everybody, and thanks for being on our webinar today.
Thank you.